everyone, my name is Celine Dumitrascu. Thank you for having me today. And today I'm going to be presenting my pilot project, which is on improving oral health in developing countries. So a little bit about me. My name is Celine Dumitrascu, as I've said, but I go by my middle name, which is Sophia. I'm a rising sophomore at Basis Scottsdale in Arizona. And I'm an aspiring pediatric dentist who does academic decathlon and biology Olympiad out of school. So let's start with the outline of our presentation. We're going to talk about the background of oral health, and then we're going to dive deeper into the oral health in Romania specifically. We're going to talk about my two-part plan, and then a take-home message with my conclusions and future directions. So what is oral health? The World Health Organization, or the WHO, defines oral health as the state of the orofacial structure which plays a part in your self-esteem and well-being and overall health. They also go ahead to say that oral health is constantly changing and that it's super important to maintain great oral health. So why is oral health a problem? Well, almost 50% of the entire world population has global diseases, and 75% of these people live in low and middle income countries. Additionally, global cases of oral diseases have increased by 1 billion over the last 30 years. So it's obviously a prominent, important global issue. However, there is hope because oral diseases are largely preventable. Through education and treatment, we can lower those numbers by a lot. In this chart by the World Health Organization, you can see that oral health is number one most prevalent conditions globally for all countries, regardless of their income. So let's talk about Romania's oral health. Romania is still a developing country in Eastern Europe. You can see that by this graph over here. It's one of the ones that has okay teeth, but not the best teeth. It could definitely improve. 75% of children had dental cavities, and 64% of these were untreated. And in a study, we saw that the mean DFD, or the number of decayed, missing, and filled teeth, was 4.89, compared to Greece, which had the lowest one, 1.77, and USA's 2.1, which is a way lower number. My project aims to decrease the burden of oral diseases in Romania by increasing dental literacy of children and parents. And the way that we're going to do this is my two-step plan with educational modules. So we're going to teach children and parents self-care and prevention, oral hygiene, and the risk factors that they need to avoid. And we're going to be going to schools and pediatrician offices. Part one is the education in schools, in elementary schools. I partnered with a local dentist, Bogdan Grigorian, and we made PowerPoint presentations and a questionnaire to give to the children. How this is going to work is he's going to go to some elementary schools in Romania. He's going to give them a questionnaire. Then he's going to give them the PowerPoint that we created, and then the same questionnaire later to see how much they retained and learned. And then we're going to distribute take-home flyers that I created. This is some of the things that we're going to be covering in the presentation. We're going to talk about the optimal nutrition, what healthy teeth look like, how to maintain healthy teeth, what tooth disease looks like, and what a dental office and dental visit looks like. These are the educational flyers that I created. I'm bilingual and my family's from Romania, and I just have deep, strong ties in Romania. And so I felt like it would be very beneficial if I created these. This is just a recapitulation of the PowerPoint presentation. And then this one is just a crash course on the techniques of how to brush your teeth. Part two of this plan is tackling the pediatrician's office. I created a wall poster for the pediatrician office, which we'll show you later, and magnet flyers for the children to take home after visiting the office, which are actually just the same as these, but just magnet form. And then the pediatrician will be sharing a TikTok and Instagram posts to the children because social media is such a great tool to reach such a large audience. This is the wall poster that I created. It's just, did you know facts about oral diseases that are beneficial for the children and the adults to know? And these are the social media links. I have an Instagram post and a TikTok post. And monitoring the impact. Monitoring the impact is essential to this project because of our future directions. So how we're going to be monitoring the impact, we're going to be doing this in two ways: the short-term impact and the long-term impact. The short-term impact could be seen by the improvement of the children on the post-PowerPoint questionnaire when Bogdan Grigorian goes to the schools, and then the number of views on the social media posts on TikTok and Instagram. And the longer term impact is, okay, you know what you're supposed to do, but are you actually doing it? And there's going to be a partnership between a pediatrician and dentist to show if this plan is actually working and if there are decreased cavities and healthier teeth. In conclusion, oral health is super necessary for general health because if you don't have oral health, it leads to greater risk hazards down the line. However, most oral health conditions are preventable, which means that those greater risks are also preventable. Partnering with dentists and pediatricians to educate the children is such a great tool to mitigate the burden of oral health diseases in Romania. Our future directions is to analyze the results of this project and maybe do a little bit of tweaks if something didn't work, and then implementing it throughout Romania as a whole, not just in Bucharest, where my two stakeholders live. These are my references, and I would like to acknowledge the leaders at the Johns Hopkins Global Leaders Conference for having me today. Irina Dragan, my mentor, who is actually also an associate professor at Tufts, and Bogdan Grigorian and Cezar Dumitrascu, my two stakeholders in Romania. And so thank you so much for listening. It has been an honor to present here. This is my email if you have any questions or if you want the links to anything. And yeah, thank you so much for listening to my presentation.